Let's now move to the next fellowship exam, which is a newer pathway. It's a more modern pathway called Ophthalmology Foundation, or Fellowship of International Ophthalmology Foundation. So this has been created based in the USA, in San Francisco, to parallel the ICO pathway. So you will find a lot of similarity between both pathways, starting first by the visual sciences exam with no experience required, then optics and refraction and instruments exam, and again you can take only one exam or you can register both exams in the same sitting, and every exam is independent from the other, so you can pass one and not pass the other, and still the passing of one exam can be credited to you. And after passing these exams, you will become eligible to the clinical ophthalmology exam. And this is the crucial part or crucial difference between the FIOF and the FICO exam, that there is no advanced exams here. Once you pass the clinical ophthalmology, you are entitled the post-nominal fellow of International Ophthalmology Foundation. So this is a good advantage. And also it can provide you subspecialty exams, which you usually would require around 1.5 years experience in the subspecialty. Okay, so this is the mapping of this new pathway. So what is the logistics dashboard? What is the format of this exam? You will find it is almost identical to the ICO exams. So visual sciences can be 120 questions in 3 hours. Optics, 60 questions in 1.5 hours. Clinical ophthalmology is be less demanding than the clinical ICO. It's only 160 questions in 4 hours, rather than 200 questions in the clinical ICO. And the venue, it is done online, which is giving you some convenience, but not online at your home, like for like FRCS Glasgow or FRC of London, but it is online at the local test center. So they will give you what test center to be doing this exam or where to do this exam, but you will do online rather than paper-based as in the ICO. Next date will be in September this year, and the fees will be quite cheaper than the ICO, cheaper than the other exams, and these exams are mainly developed for the developing countries, so they would give a World Bax Index tiered pricing, will change the price depending on the economy of the country you are from. But to give you an indicative fees for developing countries, it would be as low as $150 for visual sciences. Optics can be $100, clinical $250. And not only that, but they can also offer installments plans or payment plans if you are struggling to pay these fees. For the developed countries, it can be as high as almost like maybe 3 times higher, but you need always to check with the organizing committee about the actual fees of your exam in your country. So what are the pros and cons of this exam? The pros is that it is modern exam, and by modern I'm trying to give you an idea about the difference between this exam, as I'm trying to always draw a parallelism between it and the ICO. So comparing it to the ICO, I would classify ICO as historical. Some questions can be really confusing. I think we have been all there. We've been all trying to decipher the ICO confusing questions, the stems, the confusing answers, sometimes questions with 2 correct answers, and then we see in the questions feedback or in the answer sheet that some questions have been omitted or deleted or cancelled from the exam because the structure of the question itself is quite confusing. In contrast, the FIOF exams can be quite modern, like less confusing. They are built on the curriculum of the basic sciences curriculum of the or the basic sciences and the clinical sciences curriculum of the American Academy of Ophthalmology. Remember, I told you this is based mainly in San Francisco in the USA. So the exams can be quite less easier and less confusing than the ICO. Also, as we mentioned, there is low cost fees, installment plans if you struggling with the fees. No experience is required, so these exams are mainly done for the juniors. So this is for the entry level in ophthalmology, where if you wanted to start something, usually most people would start with ICO and now the Ophthalmology Foundation exams. Comparing to the ICO, there is no advanced exams, so this will put something out of your shoulder that you don't need to go through a lot of exams in order to gain the title. And also there is fellowships. So this is a collaboration between the Ophthalmology Foundation and the International Ophthalmology Foundation Fellowship Program. I think it has some sort of connection to Europe, but I'm not quite sure. It offers the same like the ICO fellowships. It offers you a subspecialty training for 3 months or 1 year to young ophthalmologists less than 40 years old from developing countries, so that they can train and go back to their home countries. And as we speak for now, the exams of the Ophthalmology Foundations give you extra points. As with the ICO, it can give you extra privilege, but they are not a must. They are not a prerequisite. However, changing from July 2027, the Ophthalmology Foundation exams would be a prerequisite before applying for the fellowships. So bear in mind that if you want to apply for these fellowships, then it's ideal that you start applying before the July 2027, as after this date you will be obliged to apply for the exams and pass the exams. But the question is, do you have to go through all these exams if you have cleared some of other exams? Here is the answer. The good news is that there are good exemptions from this exam. Or before we speak about the exemptions, we speak about the what are the challenges or the drawbacks of this exam. Similar to the ICO, it is still a purely theoretical exam. No practical component, so it does not give you a license to practice. And the main challenge here, comparing to the ICO, that it is not as widely recognized as the ICO. It is still in the early recognition phase. It is still being introduced to many countries. I believe that at some point it will be recognized as the ICO, but we are still not there yet. So newer pathway, recognition is variable, so you need to think carefully about that. And as we speak for now, it is not recognized by any Royal College. So while the ICO is recognized by the Royal College of Surgeons of Glasgow, the FIOF is still not recognized up to date. Okay. So what are the exemptions? Well, the visual sciences and optics and the clinical do not exempt you from any other exams. There are other exams that exempt you from the visual sciences and optics of this FIOF exams, like the ICO, the FRCS Glasgow, and if you have the old FRCS Edinburgh, you can still proceed to the clinical FIOF exams. However, these exams on their own, they don't exempt you from any other qualification. As we said, they are still not recognized by any Royal College. So be quite aware that if these exams are going to be just more of a title, more of a recognition, but it's more likely it would be a dead end for now, not going to progress you further to any other fellowship or any other Royal College fellowship exams. Okay, so this is an overview of the Fellowship of International Ophthalmology Foundation.